This is an elective activity on evidence-based practice breastfeeding solutions for the BSN class 381. The outcome for this presentation is that at the end of reviewing these clinical scenarios, you will be able to evaluate and access breastfeeding resources and implement solutions for breastfeeding families in clinical practice settings. Record. Your objectives for this presentation are to be able to evaluate at least 2 breastfeeding resources for nursing mothers and families, interpret laws supporting breastfeeding mothers at their place of work, locate a breastfeeding resource near your place of work or home, and then be able to select at least one opportunity for lactation continuing education for healthcare professionals. So in this presentation, you'll be given 5 scenarios. You'll view those and you'll be given questions to answer related to nursing staff communication with Erica and her family about her desire to breastfeed her baby. And you will be asked to comment and think and reflect on the videos. After viewing each video, you should choose the best answer for how the nurse should respond to Erica based on evidence-based practice. Erica on the right is a 28-year-old female with a history of mild coarctation of the aorta. She is otherwise healthy. She's pregnant, which puts her at risk for heart issues related to increased blood volume and bicuspid aortic valve dysfunction. Erica is meeting with her cardiologist on the left about her pregnancy and heart condition. The physician congratulates her on her pregnancy, and Erica states that she's very happy but acknowledges the cardiologist's concern. The cardiologist states that they've discussed how pregnancy can affect her heart condition, that they'll monitor her closely and hope for the best. He reminds Erica that she may need a surgical procedure in the future. Erica appreciates his concern and thanks him for looking out for her. Question 1. What resources can the office nurse at the cardiologist's office refer Erica to? There's internationally board certified lactation consultants, or IBCLC, lactation educators, breastfeeding classes in the community or hospital, La Leche League, breastfeeding peer counselors at the WIC office or the health department, or Breastfeed LA? And the answer is all of the above. Oh, wait a minute. What do these terms mean? Well, a breastfeeding peer counselor is a woman who's had a successful breastfeeding experience, and they're interested in supporting other women in their community to nurse their babies. They attend a structured class at the WIC office. Question 2. What resource personnel can the office nurse consult with? International Board Certified Lactation Consultants, or IBCLC, lactation educator, breastfeeding class in the community or hospital, Question 3. Where can healthcare professionals go for continuing education for lactation management or lactation courses to continue your education and learn more about breastfeeding management? And the answer is there's many resources that you can access to have continuing education for lactation management. So the University of San Diego Extension has a lactation consultant certificate. And I have the links here so you can click on them and see what they have to offer. Local health departments, the WIC offices, they have the Breastfeeding Peer Counselor program, which is offered nationally. And they have really amazing resources that you can access. And they're supposed to and this slide has CAPA and the International Lactation Consultant Association, and they have great programs that they offer internationally. You can get that. And then there's WellStart. And all the links are here. You can click on them and look at them at your leisure. But all these 2 pages of slides here offer a lot of information for continuing lactation education. Erica enjoys a healthy pregnancy and delivery, but exhibits increased cardiac symptoms related to her coarctation. She chooses to breastfeed her baby for the health benefits for both her and her baby. Here's Erica just after delivery asking if the nurse could help her with feeding her baby and checking if the position of her baby in her breast looked correct. How do nurses help women like Erica with breastfeeding with their new baby? It first starts with nursing assessment. Have they breastfed before? Did they breastfeed successfully? What's their family culture? Do women in their culture breastfeed? Do they, they want the health benefits for themselves? You have to do a total assessment of their motivation behind breastfeeding, and then assess the woman's breast. How is she holding it? Is she holding her breast between her thumb and her forefinger? How is she offering it to the baby? Is the baby's mouth wide open? Are they sleepy? Has the woman been medicated? Is the baby sleepy? These are all things that you have to assess. How's the baby suck? So those are different ways that the nurse can assist with breastfeeding and first attachments. Skin-to-skin contact is so important for the woman and the baby to have immediately after delivery. The nurse should assist Erica to hold her breast so the baby can attach. Observe that the baby opens their mouth wide enough so that the breast with the nipple and areola go into the baby's mouth. The nurse should assess the baby's mouth position and encourage the mother. The baby's mouth, when they should be wide enough so it opens and the nipples should go all the way past the hard palate to the soft palate in the back of the mouth. Here's a video from the World Health Association that you can click on, and notice how the baby, soon after they've recovered from delivery, about 15-20 minutes, actually crawls up